How to prepare for sedation prior to dental implant surgery. If you click this video, chances are you've got a scheduled appointment to get an implant done. And you have some questions about what you can expect beforehand, what you need to do beforehand, how the process goes, how to prepare for sedation, what will happen during the implant surgery, and then also how to care for after that. So we've kind of broken that down into a couple of different videos, but in this video I'm going to talk about what happens with your sedation and how to have the most successful sedation. This video is especially for you if you're nervous about the process, if you're nervous about being sedated, and it should make you feel more comfortable about the whole process of getting the implant and also being sedated for the process. Hi, I'm Dr. Brett Langston, an experienced prosthodontist and director of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth. So what do you need to do in the few weeks or days leading up to surgery? First of all, make sure you fill all prescriptions prior to your surgery. The last thing you want to do is be sore and have somebody running around trying to fill your prescriptions. A lot of times with pain and discomfort, we found that getting ahead of that makes it a lot easier to manage. It's really difficult to get out of pain, but if you have pain meds on board and we've planned for it, it's a much smoother process. You also want to make sure if you're being sedated that you have someone over the age of 18 that's going to not only drive you to your appointment, but stick around during the appointment and also be able to drive you home. That's really important. We never anticipate anything's going to go wrong, but it's always nice to have someone there if we do need to contact someone on your behalf. You also want to complete any preoperative testing. If we had to take a drug holiday for any kind of bone or medication, if we had to take any kind of blood thinner medications or any changes, if you're diabetic, your A1C number, these are all things that we want to make sure we've squared away beforehand so we know exactly where your health is when you come in for the surgery. And this one might be difficult for some people to stop smoking before we get to the surgery. And that may be difficult for some people, which we fully acknowledge. We can help you with that, whether it's a smoking cessation program, whether it's a nicotine patch. But the key thing is smoking causes a lot of problems with healing. You create a lot of heat, there's a lot of chemicals, and also the sucking action can actually dislodge the blood clot, which can cause failure. So you may be wondering, why is it important to have a blood clot? Blood clot is vital to keep the area full of nutrients and oxygen, because if you dislodge that clot, a lot of times not only can you get cell death, you can get bone death and bone loss. So it's vitally important to keep that clot. So things that create a sucking motion, smoking, hard sucking through a straw, anything along those lines can actually create a force that pulls the blood clot out and might cause the implant to fail. One other thing to make sure you discuss with us before the surgery is if you're on any natural medications or supplements. I'm a big fan. I think they're great. There's nothing wrong with them. But some things like your vitamin E, your St. John worts, or other things that have to do with your blood and your healing could play a role in a negative factor in how you heal after the implant. So just discuss that with us, and if necessary, we can talk with you, talk with your physician, and we can make sure that we're setting you up for success. So what do you need to do in the few days leading up to your surgery? I would definitely cut back on caffeine. If your daily coffee is necessary to get you going and get you out of bed, that's fine, but we just don't want too much caffeine. And also focus on really hydrating in the couple days leading up to your procedure. Overhydrating gets your cells in your body a much easier situation to heal themselves, and is going to make the whole process go smoother. Another thing to avoid, especially for the 24 hours before surgery, is no alcohol. I know it sounds like that's no fun, but alcohol not only causes slower healing, it's a diuretic and a blood thinner. And so it also is going to inhibit our ability to accurately sedate you. So a lot of times if you've had a good night of drinking beforehand, you may come to the surgery and we may have to cancel the surgery because we can't trust that your body's going to respond the way we want it to. So what to do the night before your surgery? Number one, take any medication that we've discussed, keep a regular profile with that. Number two, make sure you have your driver set up and everything is prepared, your logistics worked out. Sometimes for oral sedation, we have you take one pill the night before, then one pill the day of. So you want to make sure you've kind of got coordinated your arrangements and everything beforehand. We also want you to avoid eating or drinking anything after midnight. So when you get up in the morning, it's okay to have a sip of water if you have to take medication, but we really want you to come to surgery on an empty stomach. So no breakfast, no coffee, nothing. Just come on an empty stomach, and that's going to allow us to control the surgery much better. So you may be wondering, why no food and no drink? The main reason is we want you to have an empty stomach, because a lot of times if you do have a negative reaction and you do vomit, we don't want you to aspirate that. We don't want that to get and contaminate the field that we're working in, which is in your mouth. And also another reason is we'd like to avoid multiple bathroom breaks during the procedure. So what do you need to wear for your big day of surgery? We definitely recommend comfortable clothing. So loose fitting clothes, short sleeve shirts, because we do need to take your blood pressure and maintain that through the whole process. And so having to go over a large jacket or a coat is inconvenient. But we want you to be comfortable. Comfortable shoes, comfortable socks. Sometimes when you get sedated, you can get a little bit cold, so socks will keep you nice and warm. I would avoid any jewelry, watches, no painted fingernails. That's a big one, especially because the pulse oximeter sometimes can have issues. And one of the first signs of lower oxidation is a discoloration in fingernails. If you've got them painted, we can't see that. So there's just a couple of tidbits to keep in mind before your surgery. If you're prone to getting cold, multiple layers are a great idea. A short sleeve t-shirt so we can still maintain the blood pressure, maybe a jacket or a hoodie on top, and we've got blankets as well to keep you nice and warm in the operating room. So your surgery is done, successful, everything's great, you're on your way home, and you're probably wondering, so what do I need to do now? A common question people have after implant surgery is, what can I eat? Don't worry, we've got a video that got you covered. Just click on this link and we'll walk you through that process as well. This is Dr. Brett Langston helping you watch your mouth. I'll smile. Okay, I'll smile.
But like the smile is nice.
I can smile. I like to smile. Smiling is my favorite.
I feel like we should even have her place a little ding sound effect on it too.
Ding! That'd be awesome. She put a little sparkle in there.
Yeah.
Smiling is my favorite. Okay. All right.